Daratumumab has changed a paradigm shift on transplant-ineligible multiple myeloma, as shown the data of the Alcione and the Maya trials. Although no head-to-head comparisons between Dara-VMP and Dara-RD exist, both regimens achieve comparable minimal residual disease negativity. However, there is a gap between the progression-free survival of the Alcione trial, 3 years, and the 5 years of the Maya trial. And a possibility could be at the different maintenance strategies of both trials. Alcione, Daratumumab immunotherapy after induction, and Maya, Dara-RD until progressive disease. And with this gap of knowledge, the Spanish myeloma group developed a study in which Dara in combination with Bortezomib, Dara monthly, and Bortezomib every other week was a continuous maintenance after Dara-VMP induction with the aim to improve the data of the Alcione. In this trial, the Gen Optimal trial, 118 patients were included. The median age of the at inclusion was 77 years. Nearly 80% of the patients had more than 75 years. And it's important to mention that the 30% of the patients did not meet the inclusion criteria of the Alcione, mainly due to kidney failure. Regarding to the primary endpoint of the study, the 2 years progression-free survival after start the maintenance was 73%, with no significant difference among the cytogenetic groups or international staging status, at least at the data cutoff. Following with the secondary endpoints, near to 80% of the patients achieve VGPR or better, and in the minimal residual disease evaluable populations, 45% achieve minimal residual disease negativity. In addition, the 2 years overall survival was 90%. Regarding to the safety profile, the most common adverse event reported was infections, especially viral respiratory tract infections. A total of 25% of the adverse event reported. No cardiac, neurologic, or hematologic adverse events were uncommon, less than 5%, and no treatment-related death was reported. And to summarize, the combination of Daratumumab and Bortezomib as maintenance after Dara-VMP inductions showed a sustained response with acceptable safety profile, even in older and challenging populations compared to the Alcione trial. While longer follow-up is needed, this could be a valuable option for patients ineligible to quadruplets and intolerant to lenalidomide.